Welcome back. You are joining us with 726 right here in Harrison, Arkansas, and my co-host Lisa Phillips is with us today. And actually, I'm going to let you kind of lead this segment since you recommended.
When you asked me to join you today, I said, well, who are we going to talk to? And you needed to fill in other spots. So I said, hey. About 4 months ago, I went to my primary care physician with some unusual symptoms. And of course, I looked them up on Google, and I realized that my symptoms could be cancer. But I thought, nah, because I don't have breast cancer in my family.
Okay, right. Which doesn't always mean anything.
Well,
Obviously.
true. So my primary care physician sent me to the breast center, and about 4 months ago, I was diagnosed with, let me see if I get this right, metastatic infiltrating ductal carcinoma.
Yep.
Which, of course, that's shocking
Of course.
anyhow. But as I said, none in my primary family line. Fortunately, I did a genetic test with the breast center, and I'm not passing on a gene. So that was really good news. I think I cried about that of relief more than I cried about the cancer diagnosis. But anyhow, so I asked if Dr. Lott could come, being a hometown girl, and talk about the breast center.
Absolutely.
And just make people aware that just because you don't have it in your family doesn't mean you're not at risk.
Yeah, and you're not alone in having that assumption. A lot of people, in fact, won't get mammograms at all because they think, well, my mom or grandmother hasn't had breast cancer. But one statistic that kind of knocks that point home is 75% of breast cancers happen to women without a significant family history.
Wow.
75%.
That's a big
so
percentage.
most of them.
And
you know.
I had visible signs and pain even. And I had heard that was not typical.
Pain is a little bit tricky in deciding how seriously to take it. If pain is the only symptom, it's less worrisome. But if pain is linked with firmness, bumpiness, skin changes, nipple changes, if pain is part of a spectrum of problems, then it's more concerning.
Which you had other symptoms as well.
did,
So
I
just
did.
didn't really realize what that was.
Yeah. So why should women keep up with their mammograms? Is it common that women don't keep up with their mammograms?
It's fairly common, I think in part because women are nervous.
Sure.
You know, either they think they're not at risk or they think, oh, it's going to hurt or they're going to find something, you know, almost like putting your head in the sand kind of approach.
Well, I kind of did that.
And that's common. But the sooner you can find a breast cancer, the easier it is to treat.
Absolutely.
A lot of cancers, if they're found early, just on a mammogram before symptoms happen, a lot of breast cancers don't require chemotherapy. And wouldn't that be nice to just avoid that
Yes, it
entirely?
Sure.
That's our goal. It's not always possible, but that's kind of in a perfect world, we'd find breast cancer early enough to where women just had to have it removed and that was it.
What age would you recommend that women have?
That's a great
start having
question
their
because
mammograms?
there's some different opinions out there, but I'll share mine. And I'll tell you that this guideline really fits with all the breast experts. Okay. So start at 40 and have your mammogram yearly. Okay, not every other year, not every 3 years, because if you happen to get a breast cancer that's a fast-growing breast cancer and you give it 2 or 3 years to kind of put down roots, it can be a bigger problem. So yearly, starting at 40. If you do have a family history, then we have people come in earlier, and we will tell you. If you'll call and say, hey, my mom had breast cancer, what should I do? We'll kind of customize a plan.
And of course, self-breast exam is always a first line, but mammograms are so much more, you can just tell so much more through a mammogram than you can.
With a mammogram, often you can find a cancer before you can even feel it.
Okay.
And so that's why they're kind of a good 1-2 combination. If you can feel it, don't ignore it, but even better, try and get the picture done when it's so small that it's just a tiny little, you know, grain of rice.
Right.
Yeah.
And the breast center here, there's one in Fayetteville as well as in newly formed here in Harrison
There is.
as well.
Yeah.
And tell us about some of the services there
Sure.
that can happen.
So the breast center is a group of independent physicians. So we opened this clinic, kind of hung our own shingle. This is all we do. We are just breast nerds through and through.
I've been so impressed.
Well, thank
Yeah,
you.
everybody's been so professional.
We love what we do. And like I said, when you care that much about what you do, I think it translates to patients and makes them feel more confident
Absolutely.
and comfortable.
Friendly, approachable.
Yeah, we have some really nice staff. I don't know how. We just keep getting the nicest people I know.
So what are the services that you provide?
So we, of course, provide mammography, and that includes just screening checks yearly, but it also includes diagnostic checks where a patient might have some changes on self-exam. So we do kind of the full spectrum of mammography, and that includes 3D mammography, which is a pretty big deal.
It is.
Because a lot of women have breast tissue that's hard to see through, and if you add that 3D sweep, it really makes it less likely that things will be missed. And so if you're not getting a 3D mammogram, that's another thing I would tell your viewers is to seek one out. Insist on a 3D mammogram because your insurance covers it, so why would you not get the very best version
Exactly.
of the test? So we do that. We do ultrasound, which is a nice way to have a test that doesn't use radiation. We do breast MRI. I know you've been through that. It's a little bit more involved of a test, but it's really sophisticated and really helps the surgeon kind of know how to approach a problem. We do risk assessments and genetic testing. So if there's a family history, we can tell you if you might pass it on to your children.
And that's where you had that done
Right,
as well.
right.
Yeah. And like you said, it's good to know either way. If you're positive, then you can inform your kids and they can make appropriate choices. Even better if you're negative, then you can at least say, okay, well, this was kind of a fluke, you know.
The truth is sometimes hard to hear, but ignorance is not bliss in this situation.
It's not when the reality comes at you quick.
Right.
Yeah,
Yeah,
yeah.
it sure did.
And a breast cancer diagnosis can feel like a ton of bricks, you know. But that's why we try and support patients every step of the way and explain what's happening. Because that fear is really a negative thing. But if we can explain to patients, here's what has happened, here's what's going to happen, then I think our women feel more empowered.
Absolutely.
And that's important.
Well, I feel very well taken care of. I
Good.
have great confidence in my doctors. I've had super support from my friends and family. So if you're going to have breast cancer, I guess
Well-
I'm very hopeful, you know.
Yeah.
It makes you, it reorders your priorities.
I'm sure that's
So I
true.
wake up every morning a little more grateful than I ever have been.
And I know when you first were diagnosed, you said it was kind of overwhelming. Well, it's very
It's- yeah.
overwhelming. And I've seen you throughout this whole process as far as you have realized that, you know, the first things they told you may have just kind of gone,
Absolutely.
you know,
yeah.
because there's a lot of
And that's why it's good to
information.
take somebody with you.
Yes.
And
True.
also to take notes and have
Yes.
your questions ready to ask.
And I'm sure the breast center is, could be a very good, you know, help with where to direct you
Very
after
much
that
so.
diagnosis.
Very much so.
Right.
So I have chemo every 3 weeks, and chemo's different for everybody,
It
isn't it?
is. It's pretty customized now,
Yeah.
which is remarkable. Yeah, that's one really neat thing about modern medicine is when we do the biopsy and get the result back, it's not just yes or no. It's kind of shades of gray,
Yeah.
you know, and so the oncologist can really customize the chemotherapy specifically for your tumor type. And people do so much better now than they did 20 years ago with chemo.
Absolutely. It's- yeah.
And often the side effects are less. You know, it's still not fun, but it's not kind of the horror stories you hear about from 20 years ago.
Oh.
And that's important, I think, for your viewers to know. You know, take away a little bit of that fear to where if you did have to walk that road, it's much more manageable now, especially
Right.
with support.
Yes.
And I'll kind of give a shout out, if you don't mind,
Please.
to a local organization, NAFE, North Arkansas Partners for Health Education. It's a partnership between the college and the hospital. They do a great job of helping women who either have financial difficulty or transportation difficulty. They are willing to step in beside you and help, especially if a woman doesn't have as big of a family or friend support system.
Right.
So if anyone needs help with breast health or a breast cancer diagnosis, NAFE is a really good local organization here in Harrison.
Do you know off the top of your head the number for the breast center? People can just call and make a mammogram appointment there.
You know,
I
I was going to say,
I
we
don't know
have
if I
so
have
many
it on-
numbers.
I've got
think I've got it on my
479-442-6266.
That's it. That's
I think
it.
is it.
So I think last time I was on, we almost gave out my cell phone number.
She doesn't want to give out her cell phone.
Just call me directly.
But the number for the breast center is 479-4442-6266. 442-6266. And even if you're making an appointment in Harrison, call that number and they will.
Yep, they'll direct you to the appropriate
correct.
clinic. Yeah.
Do you have any last minute, anything you want to? I know you could spend a lot of time on this subject,
but I won't today.
For today.
Maybe
Well,
another time. But thank you for what
Of course.
you do.
Yeah. And we're going to keep walking the road with you. I mean, I think you're in good hands.
Oh,
and,
absolutely.
you know, we just try and give patients a plan too, because a plan can really help you at least know what's up next.
Right.
Right.
And you're in the thick of it.
I
but
have a 15-month treatment plan. So I've got about another year to go, which seems like a long time. But so many have survived, as you said, and those breast
you're
cancer
here.
survivors,
Yeah.
they're the best. It's not the club you want to join, but those that have walked this road are so supportive and helpful.
Yeah.
So
Well, and thank you for sharing your story. I think
Yes.
it'll help women.
I hope so.
Yeah.
I hope so.
I do.
Get your mammograms.
Listen to Lisa and listen to Dr. Lott. We will go to break, and when we return, Reagan Leslie will be up with, she's with the Brick House Fitness. Stay with us.